Hey everyone, it's Jessica from Stitchhouse. I'm trying something new. I hope you like these videos. I'm not sure where they're going yet, but the whole point is to have fun and talk to cool people, and that's what I plan on doing. So if you like this video or you find something really interesting in it that you think you could share with somebody else, I hope you do, and look forward to creating more things in the future. Thanks for watching. So
Perfect.
I'm so excited to have you. We talk every day, so pretty much everybody I've interviewed so far, I like talk to them every day for the most part, except for like Trevor. And then I'm like, all right, and then we just have to like continue the conversation here on the internet.
Great. Slightly
Why don't you?
filtered.
Yeah, slightly filtered. Yeah, we won't give everybody all of the juicy details of our WhatsApp combos. Tell people who you are and where you come from and a little background on you.
I'm Lindsey Tavakolian. I am a plastic surgeon. I am finishing my 6-year residency, which is one of the longest surgical residencies there is outside of neurosurgery. And I am starting my career in private practice in Highland Park. Um, and that's where I'm at.
When you say that, I get chills. I'm like, she's so cool. I think you're one of the coolest people I know that doesn't know it. I would say that about you.
Huge compliment coming from you.
Oh, thanks. It's true though. I mean, I one of the things I value in my friendship with you is you are wildly intelligent, and I don't just mean book smart. You're very thoughtful, but you also see things from a very black and white perspective a lot of times. Um, what is it about how did you bridge like your emotional side? Because I know you're very emotional and like you see things like in a certain way into something so academic, like plastic surgery, surgical residency, med school. How did you get into that? Like what was like your driving factor there?
I mean, if you want to get back to the very roots of it, when I was a kid, my mom used to make us read to get our allowance. And it was nothing. It was like a penny a page. So you could buy a candy bar by the time you bought a book, ended a book. But she gave me a book called Gifted Hands by Ben Carson. And I read that when I was 11 years old, and my 11-year-old brain just lit up, and I have no idea why. But it was when I finished that book, I was like, if this man who came from very less than privileged backgrounds can get to where he did as one of the leading neurosurgeons in the world, I think he was the first to separate conjoined twins who were joined at the brain. Just phenomenal human being. His mother was illiterate. And I just thought, I am much more privileged compared to him, not compared to a lot of people in society. But I was born with so many things he was not, and yet he accomplished so much. And that inspired me. And I just thought, I can literally do anything I want. And I wanted to be a surgeon. And that was just like a huge moment for me. So I think something important there is that moms can be so impactful. And we may have a perfect mom, we may have an imperfect mom, but their role is so important. And tiny little things that they can do in your life can just change the course of your life. And that's something that, as women, it's good to keep in our minds and our hearts, like just to know the kind of power we hold in people's lives around us. Like little small things like that can set us on fire. Um, Second, I needed plastic surgery when I was a late teen. And through the course of several consultations that I didn't enjoy, I ended up being referred to this man who was the kindest human I had met up until that point. His name was Rod Hester. He was the chief of plastics at Emory University, which was a powerhouse of plastic surgery in their day. And they're still amazing, but just powerhouse at that time. And he was the kindest person and had the most practical approach to what my needs were. And he was just so kind. And he became this huge mentor to me. And even if he wasn't like involved in my life on a day to day basis, I just had him in my mind as somebody I really wanted to be like. And so I think I just always had in my heart, even though it took me years to kind of get to the point where I was actually on track to pursuing it, I had in my heart that I think plastic surgery was just instilled in me by my relationship with Dr. Hester and how much he changed my life and my self-esteem.
And so, first of all, let me go back to the Ben Carson book. What prompted your mom to give you that book?
I have no idea. To think that an 11-year-old would be at the right place in their life to like read a book by Ben Carson, I'm not really sure. But my mom has always really wanted her children to pursue intellectual things. And my dad is a professor at Emory University. And I think we were kind of always just expected to like converse and discuss and understand things that weren't necessarily for kids. And my parents always treated us that way. And I don't know why, just call it divine intervention, but my mom just she gave me that book. I don't know why she didn't give it to one of my siblings, but she gave it to me and it just struck with me. Sometimes I
Did
think about like we don't really understand time and space, and sometimes I wonder if somewhere in time and space the
things got
wires were
mixed up?
crossed. Yeah, I just knew that that's what I was going to do someday.
Did anybody in your family have a medical background, or are you one of the first?
So I'm the first physician for a really long time. The only person, my dad likes to do a lot of genealogy, and there's somebody far back. His name is Benjamin Rush. He was the physician to George Washington.
Wow.
He was a really big part, I think, of a lot of the studies on like bacteria and like plagues and things back in the time when people didn't quite understand everything. But he is the only physician that I know of in my family history.
So what was that like? Because I know I don't know how you navigated like med school, residency, matching, that whole process. I am like a little bit privy to it now that I've been friends with you for a while and I know what goes into that. What was that like navigating that without like, having a parent that had gone through it or a sibling or somebody close? Because I know the case a lot of the times, right?
I think a lot of physicians come from physician families, and I think not to my family's fault because they just had no clue. But that created a lot of bumps in the road for me and my educational pursuits. I think I'm probably stronger because I had to get through those and figure it out on my own, and I made some bad decisions and some good decisions. I had some, mentors at universities who gave me really good advice. I had some that gave me really bad advice, and through one way or another, I eventually found the right path and navigated it. But it was a lot of just asking around and trying to figure it out the hard way. And some of it I did learn the hard way. Some of it I look back and I think that was probably not worth my effort there in that moment. But I think it was meant to be. So ultimately, I think one of my traits, for better or for worse, is I'm very stubborn and I don't give up. So
I'll talk about that later. I have a point on that. But what's most impressive too, Lindsay, is that you, not only did you become like matched to a plastic surgery program, but you matched to the best plastic surgery program in the country, right? UT Southwestern has one, like is always not like they call it the best plastic surgery program. Talk about that a little bit and that moment that you found out that you were going to UT Southwestern and what that felt like.
there were a lot of little moments along the way. I never chose this program as somewhere that I wanted to be because in my mind I thought I wanted to go to Emory because that's where, Dr. Hester had been. He was the chief of plastics at Emory and I just thought I want to live in his legacy. And life has a funny way of working things out to where you're going to end up where you're supposed to be, even if you don't know it's where you're supposed to be. And my journey with that started around the time where you start kind of picking how you rank, like where you want to go. And I was going to put Emory number one. It was close to my family. Like it was just a no brainer. And my somebody that I knew said you need to go out and visit this program in Texas. And it's just phenomenal. Like they have a great thing going and you don't have to go there, but just go spend some time working with them and you'll just learn a lot. And I was like, cool, I'll go. So I came out here for 4 weeks during my last year of medical school. And I instantly was like, oh crap. Like, this program far exceeds anything I've seen. The residents are everything I want to be. their capabilities, their approach, their passion. They were all really excited to be at work every day, even on the hardest days when they were tired and hadn't slept. Like they just had this passion for what they did. And I also saw a level of like technical skill that all the residents had that I knew I wanted to have too. And so I went home after this rotation and I met with Dr. Hester. I drove like 3 hours to meet him at his like somewhere near his lake house where he now lives retired because I was so conflicted. And I just said, I'm so conflicted. I went out to visit UT Southwestern and they blew me away. And I feel in my gut that's where I should be training. And I said, but my whole life I've wanted to go to Emory and that's where your legacy is. And I thought he was just going to say, Lindsay, don't be ridiculous. Stay home. Like, go to Emory. It's great. Everything's going to be great for you. And instead, he said, you need to go to UT Southwestern. And
Really?
I was shocked. That's not the answer I was expecting. I was kind of looking to him for like as my oracle. I don't know. I was like, thought he was going to give me like the answer for my life. And he just said, go to UT Southwestern. You have to go there. Um,
Did did he
and
have a lot of knowledge about like how innovative the program was and the way that they approach things, or what was his reason? Do you know why?
so he said, and this is not to knock Emory, but as the chief of plastics at Emory for a really long time, he said he knew their strengths and their weaknesses. And he thought that there was a time when Emory was probably stronger, but he thought that in this day and age, UT Southwestern was just the best place to train with the most resources and the highest level of training. And
Wow.
I I mean, he definitely had a lot of insight. It wasn't just, something random that he came up with. And plastic surgery is a very small community. And so he was keeping in touch with, his whole life with all these different people and kind of knew what was happening in different areas. And he just said, now is the time. You need to be at UT Southwestern. There's no doubt.
So one of the things that's like shocked me the most since becoming friends with you is how little knowledge people have of what plastic surgeons actually do. Like everybody just thinks that you're like, doing nose jobs and implants and stuff all day long. And when I got to know you more and realized how much call you were taking and like the trauma, like walk me through, tell everybody listening to this, because I'm sure some of your friends are going to listen to this, and then a lot of my customers and people in the sewing industry, what is a flap?
A flap is technically called a free tissue transfer. And it's in a simple way, it's when you're taking a piece of skin or muscle or bone off of one part of the body. So let's just talk about breast reconstruction and make it a really simple analogy. A lot of women have their breasts reconstructed with skin from the tummy. So you make cuts on the tummy, kind of like an abdominoplasty, except that you carefully dissect out blood vessels and you keep them attached to that skin from your tummy so that it can still be a living thing fed from blood vessels. But you have to connect those blood vessels back up. And so in breast reconstruction, you take that with the blood vessels still attached to it and you carry it up to the chest and then you connect it to vessels that live in the chest. And through microsurgery, you reconnect, an artery. It always needs an artery and a vein. You can connect nerves too if you need to neurotize a flap. And then that piece of tissue has blood flow from where you've set it and it can live. And so there's so many applications of that, not just for breast reconstruction. You can do it for anywhere you have a hole on your body that you need to fill any defect. But that is,
Trauma, car accidents, things like that,
yes.
right?
So a lot of fun
Um,
for like awful leg wounds from people who are in like bad car accidents who have a lot of skin missing over bone and you have to get it covered.
how many flaps do you think you've done since being in residency at UT Southwestern, or at least been a part of?
Um, I would say
Hundreds?
probably 1,000.
What?
I was trying to think of because we log all of our surgical cases. I would say that's not
Wow.
far off from a good estimate. UT Southwestern is a huge center for breast reconstruction. We also spend a lot of our year at Parkland where we are reconstructing anything that comes in the door at a level one trauma center. And so definitely on the order of hundreds, if not approaching 1,000 that I've been in that room from the time that I was an intern doing something as part of the flap.
Talk about why it's so important and humanizing to be able to do breast reconstruction for women. Like, give me like the basics, like, I mean, it's something that at our age we don't talk about a lot because
Right.
breast cancer isn't super prevalent in our age, but like when you get older, like talk about that experience a little bit.
I mean, I'm not sure there's any words that can really do it justice, but when a woman, 1 in 8 women has breast cancer. That's kind of like the stat.
Wow.
And you think it's just, older women. But I would say in my time as a resident, I have participated in an enormous amount of breast reconstruction. And a lot of those women were younger than me. And that would always really like make me pause when I would be looking at my patient's date of birth and I would see that they were like 5 years younger than me. And I would say that that wasn't a super uncommon experience to see those young
Wow.
ages. Um, but, it's one thing to be diagnosed with cancer, and that's already really mentally hard for people to come to terms with, to know that they're fighting for their life for some disease. But it's another thing that their femininity and part of their identity, something that's very obvious to other people. It's not just an organ on the inside that's like they can tuck away and not talk about, but it changes how their clothes fit. It changes what bras they can buy. It changes every aspect of their lives. It changes their intimacy with their sexual partners, marriage partners. And if they're single, it changes their ability to feel confident when they're dating. And breast reconstruction is a very large gamut of things because breast cancer can show up in many different ways and in many different stages. And there are some women who we are just happy to get closed skin on their chest just so that they don't have a
Wow.
wound, and that's the goal. Just so that they don't have a draining wound to have wound care so they can move on with their life. And other women were fortunate enough to be able to reconstruct their breasts to a point that naked, most people wouldn't be able to tell that they were reconstructed breasts. But there's many things along that scale what you can do with breast reconstruction. It all has to do with the cancer and what stage it is, and that woman's body and what treatment she's needed and radiation, etc.
Don't you think that, like, as women, and we could talk about this with like career too, but we often neglect ourselves. Like, I'm sure you've heard from women so many times after going through like chemo and radiation that they're just like, I don't even care anymore, right? And then there's some women that are like, no, give me back my boobs. Like, I want
Yeah.
them. Um, but like, do you hear, because you get to see it so often, more times than not, that there's women that are just like, I'm done. I've done the chemo, I've done the radiation, I've done the surgery to remove everything. Like, I don't want to go through another surgery. What Talk about that a little bit.
Yeah, so there's something that we always offer every single patient, which is called an aesthetic flat closure. And it just means that even if they don't want implants and they don't want a flap or some sort of breast reconstruction, we are happy as plastic surgeons to also participate in their surgery and to help close the skin that they have in the most aesthetically pleasing way that we can, but that gets them to the point where they're just done and they don't have anything more to do and they can move on with their lives and not think about it. And some women choose that, and it is the best choice for them, um, for whatever reason. And for other women, it's very important to have a breast to fill a bra.
It just depends on the person, right? I know a
Very
lot
much
of my
so.
customers, a lot of my customers have had or are going through breast cancer. So I think this conversation will really resonate with a lot of them. But it's something I hear from you that I've heard is like, sometimes people are just done when they get to the point of like the aesthetic portion of it. And you play a large role, not even just the aesthetic portion, but also the very functional portion of it as a plastic surgeon, right?
Yes, absolutely. It's our role as a plastic and reconstructive surgeon. I think that reconstructive part is a lot of time left out in modern mainstream media, but we're all trained how to do reconstruction, and that is not to make a body into some aesthetic thing, into an aesthetic ideal, but to reconstruct something into something that's functional, doable, livable, that enables the patient to get back to a point in their life where they can just move on. And sometimes that's all people want to do is just move on from like that moment in time and just be done. And that's totally respectable.
So as you move into private practice, you just took your boards that we know you passed. Not yet, but we know. we, we know because you're wildly intelligent and smart. People were probably trying to cheat off you during the. I'm just kidding. Um, no, I'm kidding. Um, no. Um, so as you move into private practice, what is like something that you want to focus on in private practice? It's at like your first time getting to be on your own and ever. So what are you most looking forward to? What are you most excited about? And yeah, tell me a little bit about that.
I'm excited to build relationships with women and to help them feel the way about their bodies, the way that, my own experience with plastic surgery has helped me feel. And it doesn't mean that, you're striving after some like insane Instagram ideal. I really connect with, and I love working with women who, have maybe had a kid, or maybe they've never had a kid. Maybe they were born genetically with, let's say, breasts that are really droopy, and it makes them look aged. It makes them look like, they've had 5 kids and they've breastfed all of them, and, they're in their 50s or 60s instead of their 20s. It can be really any sort of presentation, but my goal is to be that person in a woman's life who helps give them confidence and make them feel better about themselves to where they're no longer focused on something that's a really big hurdle for them in a day, but they're able to move on and not think about it because it's no longer a struggle for them. And a lot of that comes in the form of, mommy makeovers. So women whose tummies are stretched out from having kids and, breast surgery, breast lift, all these sorts of things. But I love working with women who have really just relatable goals, just goals that they just want to feel better about themselves.
And you bring such a unique perspective to that because there are so few women in aesthetics, right? I mean, you've seen that yourself just going to conferences and being in the world that you've been in, but there are it being a woman brings a very unique perspective to what it feels like to be a woman, obviously. So, can maybe not, but like, don't you agree, like that there's something different about the way you can connect to the patient because of your own experiences?
I do think that women can understand other women in a way like nobody will quite understand like a woman does how it is to try to fit into clothes a certain way, how it feels to look in the mirror and see a certain thing and how that impacts them. I definitely do. And I have mixed feelings about this. Not mixed feelings, but the person who did so much for me was an older gentleman, and he was incredible and he was phenomenal. And there's so many wonderful male surgeons out there who are doing great things for women. But I really do think there can be a special connection between females, and I'm really looking forward to being able to provide that, especially if a woman, is seeking that and they feel more comfortable talking about, their body and showing their body to a woman who they feel might understand a little bit more. I'm really happy and excited to fill, that, I don't want to say market because it sounds too much like it's just a sale.
I just want to say, if I asked a man this question, he'd be like, "Yes, of course, men can connect to men so much better." Like women, we are too humble about who we are and what we do. If I was like, as a man, don't you think you'll connect to men better? They'd be like, "Heck yeah, we'd connect to men better." And you still found a really beautiful way to bring it back to the doctor that helped you. And I think that's amazing. But I also think it's like part of our problem as women a little bit. It's like, come on, toot our own horns every once in a while. Right? I,
It's true.
I think what you do is like incredible. And I know that you've made, quite a lot of decisions. There's, you make small decisions every day that turn into this like large decision of now you finally finishing residency, like you said, 6 years of residency. I know you had some years in between where you worked at like the National Health. Where'd you work in between?
I I contracted with the CDC.
That's right.
I worked on a big research grant. We basically worked getting substance abuse programs into like emergency rooms and areas where people had a really big need. And I did that for a long time before I ever went to medical school. I got my master's in public health, which is kind of how I got into that
Wow.
part of and all of that. I hadn't intended to maybe spend so much time working in that before medical school, but I had intended to get my master's in public health because part of my passion is overall wellness and overall health. And I think one of the biggest things that public health pushes is prevention. And to me, like if I had to pick a dogma, it would be prevention. Like prevention through lifestyle, prevention through eating right, prevention through exercise, prevention through skincare, through, using SPF, all of these things like that to me is kind of what drives me to the core. And so I got my master's in public health and then moved on to medical school and then, completed this course in pursuing plastic surgery. But I do have a big background in public health and worked for many years in that field.
And privately, you're married and you have been married for what, 2 years now, right? To another surgeon.
Yes. Yes.
But
So I met,
go
met
ahead.
my husband in a very Grey's Anatomy-esque fashion.
Yeah,
Um,
yes.
we, I was the intern and he was the orthopedic senior because, as many people probably don't know, plastic surgeons do hand surgery. Hand
A lot of
surgery,
hand surgery.
a lot of hand surgery. In fact, if you go to your local VA hospital, plastic surgeons do all of the hand surgery there.
Wow.
I spent many years doing hand surgery at the VA, but so at Parkland Hospital, which I'm sure anybody from Dallas knows, and you should love dearly because it's just Dallas. It's just Parkland Hospital is Dallas, and it serves
It
a
is.
function and it brings healthcare to so many people that would otherwise have nowhere to get healthcare. And the really wild thing that I'm not sure people not in medicine know about Parkland is that the people who are at Parkland are, UT Southwestern residents and UT Southwestern faculty who are overseeing these surgeries. And so these people who are not, funded, who are getting all these surgeries at Parkland are getting this incredibly high level of care. And, it's an honor for us to be able to train in the facility and to get to work with these patients. And I thank, every one of them. But it's like this really cool thing where we have this powerhouse academic institution and then you have Parkland and all the people at Parkland, get to benefit and grow with us. But I was on the hand surgery service, which is like 50% plastic surgeons and 50% orthopods. And my husband, Paul Tavakolian, was the ortho senior. And I was in my very second month of residency ever. So it was like
No.
August 1st and I joined, the hand team, and he was my ortho senior. And I guess I was on for 1 month with them. I think I exchanged maybe 2 or 3 words with him, and it was mostly yes, sir, yes, sir, yes, sir. Tell me where do I need to be? Like, what patient do I need to pre-op? Like, just tell me how to do my job, and I promise you, I'll be a good doctor. And so it's kind of Grey's Anatomy because apparently he had other intentions in the background, but we had a very professional relationship at work. And
Totally.
I think maybe a couple of times he tried to flirt with me and I probably just shut him down because I was trying to be super professional.
You were probably so blinders that you didn't even realize it too, because you
Oh,
just
in fact,
you finally made it, right? You're finally in your residency.
yeah,
Like it's like a big moment in life.
my only job was I have to learn how to be a really good doctor and a really good surgeon. And I do remember thinking he was so nice. And I was currently working with Dr. Abby Culver, who is now faculty at UT Southwestern, but she was a resident with me and trained me. she was on, the hand surgery team with us. And I remember telling her, she was single at the time. I remember telling her, you and Paul should really get together because both of you are like the nicest people. And
I've heard that
she was,
before. I remember you telling me that.
and shortly after that, she ended up re-meeting her now husband. And then 6 months after I had been on the rotation with Paul, we had a mutual friend who was basically like, you really need to like just talk to him. He's a really good guy. And that was like, I put up a little bit of a fight, but eventually it proved true.
Paul broke that wall down finally.
Yes, he did.
It's kind of amazing that you've been sorry. Start that over. It's kind of
Is
amazing
that
that you've been. That's because it's in LA. It's like
the
everything here
smog?
is dirty. Leave that part in, Zach. It's dirty. I'm in LA and it's like I wake up every morning and I've got to like clear my nose out. Ugh.
Oh,
So yeah, it's a lot. We're not in Dallas. Um,
oh.
um, it's kind of amazing that you've been able to, one, build friendships and maintain them, build relationships, and get married, and all while progressing your education in a way that's like not only are you learning things, but at UT Southwestern, you guys are innovating things. And you aren't just leaving that program as a trained plastic surgeon, but as someone that looks at things, I think, much differently than other plastic surgeons do. I've seen other plastic surgeons, I've heard, I know the horror stories and the programs and the places people come from. And you've had quite the unique experience being trained at such an innovative and progressive institution that has, I mean, more flaps than anybody in the country or the world, I think. Like developing like the facelift technique, the high smash facelift. Look at me, the high smash facelift technique. You guys can tell we talk a lot. um, I've been told by other plastic surgeons that I have quite a lot of knowledge on plastic surgery. Or when I hang out with you and Paul and I say words like articulate, like I know I've been hanging out with you guys for too long. Um, but but I'm really excited for you in this next phase of your life, and I love the internet because this video is going to live on there for forever. I'm really excited for you in this next phase of your life to finally be able to bring all of that knowledge forward and help other women, with what you know. And not just from that purely like I love that you said like the Instagram like aesthetic purpose, not just from that, but from feeling really happy about who you are every day and waking up and feeling confident and going into the world. The more confident we feel and the better we feel about ourselves, the better we present in this world and the better person that we can be. And I think that that's something that you're going to really be able to do on a large scale now that you're finally finishing residency. I'm so excited for you. I'm just as excited as like anybody else in your life. I think I'm really excited. But are you are you ready for this? Are you super excited to like hit the ground running? I know you've already got cases booked and things going. So
I'm so ready. Anybody who knows me, it doesn't take much for me to just like start telling you about how exceedingly proud I am of my training. Like I will not be ashamed to say that at all because it didn't come from me. It's everybody at UT Southwestern who's poured their lives into me for the past 6 years. I am so proud of my training. We are just trained so well. They get us operating super early. For the past 2 years, I've had my own resident cosmetic clinic and I've had my own cases for the past 2 years.
yep.
And it's just a setup for success. They understand what it takes to just, train and refine young surgeons into something where you come out and you're not worried or scared or concerned because you've done it all before. And, there will always be things that I've never, encountered. And just because everybody's really unique, but I have the tools. And the best part is I have a network. I have a network of amazing, supportive mentors in Dallas and outside of Dallas who are just there for me. And I know I can fall back on them if I ever, just need to run something by them. But I just feel so prepared and trained so well. And That makes me feel good because I get to be excited about going out and going into practice instead of, worried and wondering what I'm going to be able to do
Yeah.
and not do. Because, I've been trusted by my mentors for the past many years to operate, and it's been great. It's been a blast.
I'm so excited for you. What is one last thing that you think, okay, not to put you on the spot, what's one last thing that you think every woman should know regarding their bodies?
I would say my own personal journey in learning about fertility. I would say you should educate yourself on fertility and what your, peak fertility years are. And I've always been a believer that you don't let life happen to you. You make calculated decisions. I've always believed that in relationships. You don't just, let yourself fall in love with anybody. You see what traits somebody has and you choose that person. And, you see an education program and you choose that program. I think we have a big role in determining our future. And I think whether or not you choose to have kids, not have kids, adopt kids, have a partner, not have a partner, whatever your life journey is, I think you should educate yourself on fertility and what those challenges are so that should you decide to not have kids for many years, you know what things to do to make sure that you have that ability in the future. Um, and that you just have a game plan. I think having a game plan for your life is very important. And in regards to bodies, I mean, 1 in every 8 women has breast cancer. And so never be too scared to go and get checked out. Never think you're bothering anybody or you're being too, worrisome. And then also just go with your gut. Nobody knows your body like you, and I would say that nobody is a better advocate for yourself than you. And so if you don't feel right about something, keep pursuing it until you've at least gotten to the point where somebody educated can at least lead you through it. But I think we
Totally.
are our own biggest advocates.
I want to say one, thank you for doing this interview with me. And two, I didn't get a chance to talk about this, and I don't want to like talk too much about it because we'd have to go into major detail, but Lindsay was a big advocate for me through some really difficult times. And we talked about her being stubborn earlier, and it's not just with education. She is a friend that texted me every single morning and every single night until I was able to make big decisions about my own life too. And I can only give you my personal account of the person that Lindsay is. But I hope if you're watching this video and maybe it's years later and you're looking up Dr. Tavakolian, plastic surgeon, you know that Lindsay is an advocate not just for her friends, but her patients. And she is stubborn, but in a way that you would definitely want your surgeon to be stubborn and your friend to be stubborn or your partner or whoever it is. I think that you are a very good person, Lindsay. And I think that will carry over through into your practice, your private practice, and the way that you treat other people is just so amazing. And I am so proud to be your friend. Seriously. Did I get a tear?
Well,
No, you don't cry.
yeah, yes. But then I started all my tricks of like how not to cry, thinking of horrible things.
Whoa. You are a great person, Lindsay. I mean,
Because once
and
the
I
tears
do know.
stop.
I do know though that I do know anybody that ever chooses you to have you as the doctor in their life is very lucky and very fortunate. And I'm so excited to see what you do in this next phase because finally moving on to the next phase, and I think it's really exciting.
Thank you. I'm so excited. I just want to say, many, many, many years ago, I'll make this brief, but my husband actually knew Jessica first, and he kept on telling me, he said, there is this girl who he's like, you have to be friends with. He's like, she's so badass. She has every quality that you look up to in women. He's like, she's strong. She can outlift any man in the gym, which I love. And he's like, and she's a businesswoman. He met her right when she was really getting her business off by herself, like starting it from the ground up. And he's like, she's such a badass. She's so motivated. She's so smart. She's an entrepreneur. She's starting her own business. And he's like, and she's just the coolest person. And he just like hounded me. I was like in the mire of residency and like, I don't have time for anything. And he's like, you just have to be friends with Jessica. He's like, she's just incredible. And I'm so thankful for that because I remember the first time, we went out to brunch and it's like I instantly just recognized in Jessica everything that I admire in a woman. And you know, I think, and my husband thinks, strong is sexy. And that's like something that I look up to and I look for in friends and people around me. And I hope to inspire that in other people. And not just sexy, but like strong is just like, it's so important. And Jessica is, quite possibly the strongest woman or man I know. She's so resilient. And it's just inspired me so much just being around her, just to
Oh,
see what a human is capable of in the midst of dire circumstances. And it's like iron sharpens iron. And I really hope that in our
totally.
friendship, we continue to be able to grow and feed off of each other. And I'm just excited to see, where Jessica goes in her career and just her life in general. It's just very exciting to be around and be inspired by other women who are like everything that you look up to.
I feel so grateful to be able to have these friendships that I have, especially with you. And maybe one day we'll both be famous and this will be on the internet and it'll be really funny to go back and watch. You'll be a famous plastic surgeon and I will have done something really outlandish that's landed me in the media somewhere. I don't know. I'm kidding, but it's I think what Paul recognized early on was how important female friendships are. And he
Mhm.
really cared about you and does care about you. And he knew that you were going to need maybe something just a little outside of residency. So um, I,
Oh,
I I definitely give Paul a lot of credit for that too, because he saw something in both you and I that I think is really special. And yeah, I'm so grateful you did this interview with me. Now you're off to pick paint colors for your new
yeah.
office.
Yeah.
Just go with white. Just white. Ecru. Ecru. Not white.
Exactly.
Because white would be stark. You need like a Bottega Veneta white, like that bag
Yeah.
that I
Yeah.
have. Think something just creamy, luxurious. Okay. I'll talk to you soon, Lindsay. Thank you.
Okay. Bye.
Bye.